my name is Brittany Cooper, and this is my head-to-toe video assessment. I'm going to go ahead and start by scanning the room so that you know there's no cheat sheets laying around. Okay, so before I do anything, I have checked the patient's chart. I'm providing for privacy. I've washed my hands, and now I'm going to identify myself and identify my patient with two identifiers. Hi, my name is Brittany. I'll be your nurse today.
Hi, Brittany.
Can I see your wristband? Can you tell me your full name and your date of birth?
Leanne Harp, 12-183.
Perfect. Can you tell me who the President of the United States is?
Donald Trump.
Okay. So Leanne, can you tell me what brings you in today?
Just general checkup.
Okay. And are you currently in any pain?
No.
No. Okay. So just as of right now, I'm noting that Leanne is A&O times 3. So I'm just going to go ahead and start with a couple of questions, and then from there on out, I'll start doing an assessment, okay?
Okay.
So starting with your head, do you have like frequent headaches? No. Have you ever had like any head surgeries? No. Any dizziness or lightheadedness? No, nothing like that? Okay. So as of right now, I'm going to note that Leanne's Glasgow Coma scale is a total of 15, which is normal. She's able to respond appropriately, listen to commands, and things of that nature. So I'm giving her a 15. So starting right off the bat, I'm just inspecting her hair. I am noting that it is clean and well groomed. I do not see any bugs or bumps or lesions, anything of that nature. And it's evenly distributed. Her eyebrows and eyelashes are also evenly distributed. Her nose and mouth are midline. I'm gonna go ahead and do this really quick. The top of her ears line up with the outer canthus of her eyes. So that's all a normal finding. So now I'm going to go ahead and palpate her head. So just let me know if there's any pain or tenderness while I'm doing this, okay? Okay, so while palpating, I did not feel any bumps or bruises or rashes or anything like that. No bugs were noted, anything of that nature, and it feels clean and well groomed as well. And it is normal cephalic. So now just jumping right on down to her eyes. Have you noticed a change in your vision?
No.
No? Okay. Do you have an eye doctor?
Yes.
Okay. Do you go to them pretty regularly?
Yearly.
Okay, yearly. Have you ever had like any like dry eye or nothing like that? Okay. So I'm gonna go ahead and just pull down her lower lids and her upper lids just to look at her sclera and her conjunctiva. Okay, so right now I'm noting that her conjunctiva is a nice pink color and her sclera is white, which is a normal finding. So to start with the eyes, cranial nerve 2 is the Snellen chart, but because she goes to her eye doctor pretty regularly, there's no need to test for that. So I'm going to say cranial nerve 2 is intact. So now I'm going to test cranial nerve 3, 4, and 6, which is her eye movements. I'm going to do this by doing the 6 cardinal gazes. So by doing this, I'm just going to have you follow my pen light with just your eyes open. Okay?
Okay.
Okay, so I'm noting that cranial nerves 3, 4, and 6 are intact. I'm going to go ahead and test for Perla. So I'm just going to have you look at my ear or wherever you want to look. Okay, and do the same thing. Okay, so her pupils are equal, round, and reactive to light. I'm going to go ahead and test for accommodation, so I just need you to stare off at something, and then when you see my pen light, focus on that, okay? Okay. And she was able to accommodate. So therefore, Perla is intact. So to move on down to her nose, have you noticed any change in smell? No. No. Okay. Have you noticed any like weird drainage or anything coming out of your nose?
No.
No. Do you have allergies?
Nope.
No. Okay. So for this one, I'm just gonna go ahead and take a look up in her nose. So this. Okay. So I'm noting that it was a nice pink color up in her nose. Hair was evenly. There's a little bit of hair that was evenly distributed, but just to be expected. It was nice and moist up in there as well. There was no deviations, and everything seemed to be midline and intact. So what I'm going to do right now is have her test her nose for patency. So can I just have you plug one nostril and breathe in and out? Perfect. And do the same thing to the other side. Perfect. Okay. So by her doing that, I'm telling you that cranial nerve 1 is intact. If I was in like a clinical setting as well, I would maybe put like a strong smell like coffee in front of her nose to see if she could identify that as well. So moving down to her mouth, do you have troubles swallowing?
No.
No. Do you have troubles like chewing or biting into something?
No.
No. Do you often have like dry mouth or nothing like that?
No.
Okay. So now to do her mouth, I'm just going to go ahead and take a look in there. And lift your tongue up and down, side to side. Perfect. Okay. So right now I'm noting that there are no new dental caries, but I do see some old dental work. Do you go to your dentist pretty regularly? Yeah, okay. So that makes sense considering seeing some dental work done. Her lips, actually real quick, can I have you pull down your bottom lip? Okay, and then pull up your top lip for me. Perfect, okay. So I'm noting that her lips, her gums, her tongue, her hard palate, soft palate, pharyngeal wall, and her buccal mucosa is all a nice pink color and moist. For her tonsils, I would say they're at about a +1, meaning that they're there, but they're not swollen or anything like that. So for her mouth, once again, I'm just going to have you open again, and this time I'll have you stick your tongue out and say ah. Okay? Perfect. Okay, so her doing that, I was testing cranial nerve 9 and 10. While she was doing that, her uvula and her soft palate did rise. So that is a normal finding, and therefore cranial nerve 9 and 10 is intact. For the sake of this video, for cranial nerve 9, I would test her gag reflex, but I'm not going to do that for the sake of this video. Can I have you say light, tight, dynamite?
Light, tight, dynamite.
Cranial nerve 12 is intact. So now I'm going to go to your ears. Have you noticed any like change in like balance or like you felt off? No. Have you noticed any change in your hearing?
No.
No. Any weird drainage or anything coming out of your ears?
No.
No, nothing like that. Okay. So I'm just gonna go ahead and have it take a look in there. Okay, I'm just gonna take a look at the other side. Perfect. Okay. So looking in her ears, it is a nice pink color in there. There's a little bit of earwax, but nothing excessive, which is normal. A little bit of hair as well, but it's evenly distributed on both sides, so that is also a normal finding. If I had an otoscope, I'd be able to see in further, and I should see a pearly gray color inside. So now to do like the assessment, I'm going to do what's called the whisper test. So I'm going to stand behind you, you'll hear a couple noises. Whatever side you hear it on, just go ahead and raise that hand, okay? Okay.
I'll be able to see him here.
I'm gonna turn my mic on. Okay, so that was called the whisper test, like I said before. So she was raising the hand that she heard it on. So that's normal for her. I'm gonna do what's called a Reinberg test now. So I'll have you stand up. This is just to test her balance. Stand up and then close your eyes. Okay, go ahead and sit back down. Okay, so there was no like swaying or anything of that motion. She had her balance pretty well. So I'm gonna note that cranial nerve 8 is intact. I'm gonna do cranial nerve 7 is tested mainly for like stroke patients. So what I'll have you do is raise your eyebrows, puff your cheeks, smile, frown. Perfect. Okay. So cranial nerve 7 is intact. I'm gonna do cranial nerve 11. I'm gonna have you shrug your shoulders. Okay, and then push your hand against. There you go. Perfect. Okay. So I'm noting that cranial nerve 11 is intact. But right now I'm gonna go through and do her lymph nodes, her sinuses, and then her temporal artery. So right now I'm gonna do her lymph nodes. We have preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, posterior cervical. Can I have you do one of these? This is her supraclavicular. And then can I have you put your head down? You can put your arms down. Put your head down and then kind of turn your head to the, like in. Like, yeah, work. And this is her deep cervical chain. And I'll do the same to the other side. There you go. Okay, so I was not able to feel those, so that was a normal finding. If I was able to feel those, they should be movable and soft. If they were hard and they weren't moving, that'd be of concern. Could indicate some type of cancer of some sort. So it's a normal finding that I did not feel hers. Now moving on to her sinuses. We'll go ahead and do her frontal. Any pain?
No.
Okay. And then her maxillary. Any pain?
Nope.
Perfect. Now I'm going to go ahead and do her temporal arteries. Okay. I would say they're at about a +2, equal bilaterally. So that's a normal finding. I'm going to do test cranial nerve 5. There's 2 portions to this, the motor and the sensory. I'll do the motor first. So to do this, I'm just going to place my hands here on her, and I'll have you open and close your jaw, and then side to side. Okay. Have you ever been diagnosed with TMJ? Yes. Okay. I asked her this because there was some clicking in her jaw as she moved it up and down and side to side. So since she's been diagnosed and she knows about it, I'm not too concerned about it at this point. So for the sensory portion, I'm going to go ahead and do what's called sharp and dull. Whenever you feel my pencil on your face, just tell me if it's sharp or dull and where it's at. Okay?
Chin sharp. Cheek dull. Forehead sharp. Forehead dull. Cheek sharp. Chin dull.
Okay. So I'm noting that cranial nerve 5 is intact. She was able to tell me sharp and dull, and her jaw was able to open and close from side to side. So to go back to the ears, I'm gonna do what's called push-pull push. I'm going to push on her tragus, pull on her pinna, and push on her mastoid. Just let me know if there's any pain or tenderness at all when I do this, okay? No? Okay, perfect. So I'm just going to run back through real quick to make sure I kind of got everything I needed to on the head and the face. So I did cranial nerve 1, which is her nose. She closed each nostril, checking her sense of smell. Cranial nerve 2 was a Snellen chart, which I did not need to do due to her going to her eye doctor regularly. cranial nerve 3, 4, and 6 were her eyes. I did the 6 cardinal gazes, and I did Perla. 5 was her TMJ, the one I just did with the motor and the sensory. 7 was the stroke, where I had her puff her cheeks, raise her eyebrows, smile, that type of thing. 8 was her ears, where I did the whisper test, and I had her stand up, which was the Ronenberg test for balance. 9 and 10 was her opening her mouth, saying ah, and seeing the soft palate and her uvula rise up. And then the gag reflex, which I did not do. 12 was the light, tight dynamite, and then 11 was her shrugging her shoulders and moving her face against my hand. So at this time, I'm noting that all of those are intact. So now to move on to your neck. Have you had any neck surgeries? No. Have you had any like neck stiffness or anything? No, nothing like that really? Okay. So before I do anything, excuse me, I'm gonna go ahead and test for jugular vein distension. So what I'll have her do is I'll have her lay down flat first, and then I'll raise her to about a 45-degree angle, and then to see if I can see her veins pop out or not. Okay, and then we'll do about a 45. Okay, so I did not see any jugular vein distension, so that is a normal finding. So to move on to inspecting, her skin color is true for ethnicity. I do not see any bulging or deviations or anything of that nature. Everything seems to be midline. There's no rashes or anything like that. So I'm going to go ahead and start by palpating her carotids one at a time. Okay, and then I'm going to do the other side. Okay, I would say her carotids are at about a +2 equal bilaterally. So now to go ahead and do auscultation, I'll listen with the bell of my stethoscope. And to do this, I will listen in 6 spots, 3 on each side. So for this portion, I'll just have you take a big deep breath in and out, and I'll have you hold on an exhale, okay? Okay, so whenever you're ready. Go ahead and breathe. Go ahead and breathe. Okay, go ahead and breathe normal. Okay, so while auscultating her carotids, I did not hear any bruise or swooshing in a simpler version, so that is a normal finding. So just to move on down to her chest, I'm going to start with the heart. So to do this, I'll listen in 5 spots, and I'll go over those in a second. But for starters, do you have like chest pain? No. Do you ever feel like someone sitting on your chest? No. Do you ever feel shortness of breath? No. Do you ever like get up and urinate frequently throughout the night? No? Okay. So now I'll go ahead in with the heart, and I'll start with the A, which is her aortic, which is her second intercostal space, right sternal border. I'll go to P, which is pulmonic, which is her second intercostal space, left sternal border. I'll do her Erb's point, which is her third intercostal space, left sternal border. And then I'll do her tricuspid, which is her fifth intercostal space, left sternal border, and then her mitral, which is her fifth intercostal space, midclavicular line. And the way I find this is I'll start at the top of her sternum, go down where I find like a little notch, and then kind of go to the right, and I'll fall into like a little space, and that'll be my first spot. And I'll listen to this with the bell of my stethoscope. Lift your shirt up. Okay, so while listening to her heart sounds, I am noting that S1 and S2 were heard throughout with no gallops, no murmurs or anything of that nature, so that's a normal finding. Like I said, I didn't hear any extra sounds or anything of that nature, so that is a normal finding also. So to move on to her lungs, I'm going to, on the anterior side, I won't do like a palpation necessarily due to the video and her being a female. If I was in a clinical setting, I would just kind of palpate around and everything. So I'll go ahead and start by inspecting. So right now, I'm noticing that her skin is true for ethnicity. I'm gonna go ahead and feel her temp. My hands are a little chilly, but they warm up. Her temp is warm and dry. While I'm right here, I'm gonna go ahead and test her skin turgor. Okay, so there was no tenting, so that means she's well hydrated. I don't see she's not using any accessory muscles. It's a nice easy breath in and out. So that's all normal. So now I'm just gonna go ahead and her cuffs on the front half, starting kind of up here and just kind of going down. Go up under. Okay. So while percussing, I'm noting that it was a nice resonant sound throughout, which is normal for the lungs. I didn't feel any like bumps or anything on my finger while pressing and tapping, so that's a normal finding. So now I'll go ahead and auscultate onto the front half of the diaphragm with my stethoscope, kind of in those same spots. So for this, I will just have you take a nice big deep breath in and out, okay? Every time you feel my stethoscope. Okay, whenever you're ready. Just gonna kind of go down here a little bit and then. Okay, so while auscultating her anterior side, I'm noticing that I didn't hear any adventitious sounds, so meaning like no wheezing, no rhonchi, no rattling, anything like that. So that is indeed a normal finding. So now we'll go ahead and just go to her posterior side. Perfect, okay. So to start with this, so once again, I'll just start with inspection. So upon inspection, I'm noticing that her skin color is true for ethnicity. I do see a tattoo on her left shoulder. I'll inspect down here a little bit, okay? So I see another tattoo just on her lower back. I don't see any bruising, no rashes, no bumps, anything of that nature. So now to start on the back, I will start with palpation. So I'm gonna palpate for crepitus. Okay, so I did not feel any crepitus, which would be like a nice Rice Krispie underneath the skin. So that's a normal finding. So now I'll do what's called tactile fremitus. I'll use the ball of my hand. So all I need you to do for this is just say 99 every time you feel my hands, Okay.
99, 99, 99, 99, 99.
Perfect. Okay. So while doing that, as I placed my hands up top and went down, the sound did diminish. So which is to be expected. So that, like I said, is a normal finding. So now we'll do what's called symmetrical expansion, but first I'll map out my lung fields on the back, starting at, can I have you put your head down? Perfect. Starting at the top, which is C7, going down to like the bottom of her scapula, which would be like T7, going down 3 more, which would be T10. These are my lung fields right here. This is where I will be percussing and auscultating later in the video. So when I do symmetrical expansion, this is where I do, I go down to T7, go down 3 more to T10, and I'll pinch right here. So what I'll have you do is take a nice big deep breath in and out. Perfect. So while doing that, my hands rise and fall at the same time. So that is a normal finding. So now I will also do what's called AP diameter. So I will measure her side to her back, starting over here. Okay, so her AP diameter is a 2:1 ratio, meaning that the one side is equivalent to her entire back. So that is a normal finding as well. So now I will go ahead and percuss on the back side, starting, like I said, at C7, going down to T7, T10, doing that in the entire field. Lifting your shirt up, so you know. Okay, so while I was percussing, on the posterior side as well as a nice resonant sound, which is to be expected in the lungs. So now I'll go ahead and auscultate in those same spots with the diaphragm of my stethoscope. Same thing for this side. Whenever you feel my stethoscope, just take a nice big deep breath in and out, okay? Okay, so while auscultating on the posterior side, I'm noting that there was no adventition sounds once again, so there was no like wheezing, rattling, any ronca, anything of that nature. So that is also a normal finding. So now I'll go ahead and go to her abdomen. So I'll just have you lay down. Okay, so for this one, just a couple more questions for you, okay? So do you currently take medications?
No.
No, okay. When was your last bowel movement?
Today.
Okay. Can you tell me kind of what it looked like?
Normal form.
Normal formed, okay. Does it burn when you urinate?
No.
No? Do you feel like you're often urinating like frequently?
No.
No. Have you ever seen any like mucus or blood in either your stool or your urine?
No.
No. Have you noticed any changes in like your appetite?
No.
Any nausea? Nothing like that? Okay. Can you tell me when your last menstrual cycle was?
2 weeks ago?
2 weeks ago? Okay. Would you say it's like regular or irregular?
Regular.
Regular, okay. And do you perform self-breast exams about once a month?
Yes.
Yes? Okay. Okay, so now to start with her abdomen, I'm going to go ahead and start by inspecting it. So I'm just going to have these down a little bit. Okay, so while inspecting, I'm noting that I do not see, once again, any bumps or bruises or scratches, anything like that. I'm noting a little bit of striae, but as to be expected. Her umbilicus is midline. Her contour is flat. I didn't see any pulsations or anything like that. Just kind of looking again. Okay, so I'm gonna go ahead and start by auscultating first, because if I was to start by palpating or percussing, that could present some bowel sounds that might not actually be there. So we will start to do this with the diaphragm of my stethoscope, starting in her right lower quadrant, going to her right upper, left lower. So for this, you can just breathe normally.
Okay.
Okay, so I am noting that there are bowel sounds present. I would say they're about normal active. If I didn't hear bowel sounds in any of the quadrants or one of the quadrants, I would sit and listen for about 5 minutes before I determine if there's no bowel sounds present at all. So now I'm going to go ahead and auscultate her arteries, starting with the upper half. So I'll make a W on top of her umbilicus, and then my middle finger will be her aorta, and my pointer finger and my ring finger will be her right and left renals. So I'm going to go ahead and do that with the bow of my stethoscope. Okay, and now I'll listen to her right and left iliac. So I'm making a V with my fingers, or my pointer and my middle finger will be her right and left iliacs. Same thing with the bow of my stethoscope. Okay, so while auscultating those, I am noting that I did not hear any bruise, so that is a normal finding. So now I'm going to go ahead and do percussion. I'll do a couple spots in each quadrant. Okay, so while percussing, I did hear a nice like tympanic sound, which is to be expected in the abdomen, except for over the liver, it was a nice dull sound. But that's also normal considering that's a hollow organ. So now I'm going to do what is called a light palpation. I'm just going to do that in a couple of spots in each quadrant. Once again, starting with her right lower going around. If you feel any pain or tenderness with this, just let me know, okay? Okay, so while I was palpating, I did not feel any masses or anything bulging or anything of that nature, so that's also a normal finding. It was also a nice like soft texture. It wasn't firm. There was nothing, she wasn't guarding or anything, so that's a normal finding. So now I'm going to mention deep palpation, but I'm not going to do it due to just for the sake of this video. So for deep palpation, I would go a nice like 3 to 4 inches. But that's not really necessary for this video, like I said, so I will not do that to her. Plus, it's very uncomfortable for the patient. So So that's it for the abdomen. We'll go ahead and cover you up. So now we'll start with her upper extremities. So you can go ahead and just sit up. Okay. So for her upper extremities, I'm inspecting them. I'm noting that her skin color is true for her ethnicity. I'm going to feel for temp. Her temp is a nice, warm, and dry throughout. I'm going to go ahead and feel for edema. I do not feel any edema, so that is also a normal finding. So I'll go ahead and listen to her, or not listen, feel her radial and her brachial pulses. So we'll start with her radials. Okay, I would say her radials are about a +2 and equal bilaterally. So now we'll go up to her brachials. I would say her brachials are also at about a +2 and equal bilaterally. So now I'll do what's called capillary refill on her fingers. And then on the other hand, okay, so her capillary refill was less than 3 seconds, so that is a normal finding. I'm gonna have you grab my fingers. Perfect, okay, and then push against me, okay, and then put your hands on the other side and pull against me. Perfect. Okay, so her strength is also equal bilaterally, so that's also a normal finding. So now we'll go down to her lower extremities. So I'll just have to scoot back here, yeah. Yeah, that works, okay. So same thing, I'm inspecting, her skin color is true for ethnicity. I do see a tattoo on her right ankle. I'm gonna go ahead and just kind of feel for temp. Her temperature is a nice warm and dry throughout. I'll feel, that was edema, I'm sorry. So there was no edema noted, and then I'll feel her temp on the back side is more accurate. So that is warm and dry also. I'm gonna try and feel for her popliteals, but these are usually pretty difficult to find. So I'm gonna go ahead and just kind of slide my hands up. Go ahead and bend your knees like a little bit, yeah. Oh, okay. So those are at about like a +2 equal bilaterally. I'm gonna go down to her posterior tibials. Those are also at about a +2 equal bilaterally, and then going down to her dorsalis medius. Which are also at a +2 and equal bilaterally. So now I'm gonna go ahead and do cap refill on her toes. And then her other foot. Okay, so her cap refill was less than 3 seconds on her toes, which is a normal finding as well. There is some nail polish on her toes, but I'm able to see through to see the refill come back. So that is a normal finding. I'm gonna do, can I have you raise your legs, one leg at a time? Just, yep, down, and then the other side. Perfect, okay. I'm gonna have you pull against me, okay, and then push against me. Perfect. So her strength is equal bilaterally in her legs, so that is a normal finding. So now I'm gonna do what's called a Bombinski reflex. I'm gonna slide this on the bottom of her foot, and she should react. Okay, so she reacted, so that is a normal finding. Right now I'm gonna note that her gait walking into the room was steady. Like I said earlier, her language was appropriate and clear. Throughout this video, I was kind of assessing her body language and her attire, and she's dressed appropriately for the season. Her body language was intentional. She was able to follow commands. Like I said earlier, she was ANO ×3. And I think that concludes this video. Do you have any questions for me?
No?
No? Okay. Thank you.